approximately 20 years ago, you started your career as an ER physician at Etobicoke General Hospital. Now you lead the same organization. How does it feel to be the president and CEO of William Osler Health System, one of Canada's largest community hospital systems? And if you could do it all over again, what would you do differently?
It was actually 24 years ago, and I don't think I would do anything differently. I had moved here from a small town. I practiced small town medicine. And I came back to Toronto because my mom was ill. And I ended up starting a family practice with my own family doctor. Dad advised me saying that, go talk to Dr. Mogul, maybe you can work with him. And it was about a month and a half of working with him that I said, listen, I really still want to do emergency medicine. And is there a hospital here that I can work at? And he said, well, there's one down the street at Etobicoke General. It's part of that new William Osler group. So I just walked into the Emerge, asked for a job, and he gave me a job as an Emerge physician. And I didn't come in to be a CEO or even the chief of a. But over the years, of course, I've been lucky enough and have been asked to do various different leadership positions, whether it was the site chief of Emerge, the chief of Emerge, VP, executive VP, and now CEO. And no, I wouldn't have changed anything, because I think being in an organization as their leader and the organization that you know very well, you know all of your team, your vice presidents and your executive vice presidents and directors and managers, but you also every other person in the organization because you have worked with them on the front lines. We've fought battles in patient care together with the help of porters or housekeepers, kitchen staff, admin assistants, clerical associates. It's not all about doctors and nurses. When you lead an organization like that and you trust your team and they trust you, it's a completely different feeling, and I wouldn't have done it any other way.
It's definitely a special bond that you've created. And how does it feel emotionally to be leading this huge organization?
It's actually pretty surreal sometimes. I live in this community. Most of our employees live in this community. I have gotten care of myself within this organization. So really a sense of belonging emotionally. And it's really a sense of wanting to do the best we possibly can for this community, whether it's in the day-to-day care that we provide or in new healthcare infrastructure that we want to bring to this community. So we're really grounded in that. And I really feel that any difference that I make at Osler will be a difference for our community, but also a difference for me and my family because it's my community.
There's a personal connection there. And what inspires you to wake up each day? You said you live within that same community and you're so committed to doing the great work because you're part of that. How would you define your own why?
Yeah, and I think that's important. I don't wake up thinking that, okay, my goals and objectives are to build, 2 more hospitals in this community and to have this, fancy system and to have cardiac surgery and neurosurgery. Those are goals that, yes, strategic goals that we want to accomplish. But really my why here is to provide the highest quality of care to the patients that walk into our organization and to support their families the same way. These communities, whether it's in Etobicoke or in Brampton and Peel, many of these people are new immigrants, middle-class families who are working hard to have a comfortable life, to put their kids through school, to pay their mortgages. And when they get sick, they just want to come and get first world care. And that's what we want to provide. So yes, I always remind my team that having these lofty goals of doing these wonderful strategic things, that's great. That's a part of what we do. But the reason we are here is for that heart attack to walk into this Emerge, or for that cancer patient to come here for chemotherapy, to make sure that that person has the best possible experience. We support them and we support their families and loved ones when they're here. Now, at the same time, while you're doing that, the other thing that makes me want to be here is to make this one of the best places to work for our staff and our team members and our volunteers. So they can come to work looking forward to doing the work that they have to do and being proud of being here.
That's such an important message, especially now when we are facing, a huge health human resource crisis. How are you managing it at Osler? And how are you, making sure that staff still want to come there and be there to work and find meaning in what they do?
Yeah, it's such a dichotomy right now. You have health human resources crisis across the province and perhaps the country. And then you have the pandemic where people are actually asking themselves, do I really want to work in this environment, or do I want to be somewhere that may be safer? At the same time, we're talking about mandatory vaccinations and how that is impacting people that are working already in the system, or people that want to come in. But these are challenges that we've been facing for years. The day that I walked into the Etobicoke General Emergency Department and my first shift, we were short of nurses that day. We were short of physicians that day. What COVID-19 and the pandemic has done is that it has just brought it to the forefront.
Right.
Within healthcare, people have known this all the time. And what are we doing? We are trying to do a lot of things that have to do with physician wellness, staff wellness, physician and staff engagement, providing a healthy place to work, providing opportunities for our staff to have downtime even during their shift, creating things like respite rooms. These are rooms where a staff person can go in, grab a granola bar, grab a drink, and sometimes even get a shiatsu massage, people that come into our organization. So we're really looking at the health and wellness of our staff members and asking them to engage with us to tell us what else we can do. Now, there are limits to it within our budget, but the respite rooms have been a big hit for us. And then we've got these things called respite carts. If a floor is really busy, their manager can call down to the respite room that, we can't really get breaks on time. People are struggling. They're working through their breaks sometimes. So then we take a cart up so people can have beverages. So those are just very small things, but those are some examples of some of the things that we're doing to maintain a healthy balance at work, and at the same time, trying to attract new staff, understanding that they're going to be walking into a workplace that is a healthy place to work.
And were these implemented after COVID, or were you doing some of this already previously?
Well, we were doing some of the wellness work before COVID, but these other features have all been implemented after COVID. And you try to take the good out of any challenge that you have, and COVID has done that for us. Not only has it helped us focus on our staff and their families, but also it has brought such new innovation, basically forced us to become innovative. And virtual care, virtual registration in the emergency department, our virtual urgent care department, these are all things that I think would have still happened, but would have taken a much longer time if it wasn't for this pandemic.
And that's such an important issue in healthcare, because everything that we do in healthcare is typically, a few years behind the other sectors. And we've seen now that it is possible to do it at a faster pace. So how do we continue, innovating and keeping up with, what's going on and what's best for our patients and our staff, rather than going back into what we were previously doing?
Yeah, I think as leaders, and this is something that I will be doing, one of the things that I will be reminding, and I continue to remind our team members, is that, listen, it's not really that hard to go from an idea to a pilot project to something that you're actually doing every day. And we did it during COVID. And not only did we do it, did it under some extenuating circumstances. So, grasp that and think about that and go with that, so that when we are out of this pandemic and we have new ideas and we have innovative ideas from our team members, you don't have to think about the fact that, okay, now I got to get a project manager, set up a task force, go through 7 months of meetings, look at the risk benefit analysis, and then 2 years later, you're launching a project that everybody else has, or a product that everybody else has had for years. One of the lessons that we've learned is that you can really quickly get things going. Now, the fact that the province opened up some of its coffers and gave us some extra funding did help, but I think there are ways to think outside the box and still make that happen in a shorter period of time, and that's a lesson that we've learned, and I want to propagate continually here at Osler.